Okay, it's 4 a.m., so I think we're ready to start. Hello, everyone. Thank you for joining this third webinar of the World Duchenne Organization. My name is Suzanne, and I'm the Communications Coordinator of the World Duchenne Organization. And I'm here together with Elisabeth Vroom, who is the chair of the WDO, and together we'll host the third webinar regarding this COVID-19 pandemic in relation to Duchenne and Becker muscular dystrophy. So some people already know the drill. You will be muted upon all time because we're with quite a large group, so please keep muted all the time. If by any chance you unmute, you can click on the microphone below to mute yourself again. And if you want to say something in the chat box on the top right, you have a speaker bubble. So if you would like to say something, you can do it via the chat. And this time we're actually aiming for a bit more interaction during the webinar. And this is also the reason why we ask to invite a maximum of 2 persons per organization to join. Because we will have an interactive part. We will ask each of you to answer a few questions. So when the time is there, Elisabeth will call your name. You will unmute yourself by clicking on this red button below in the screen. And you can do the talking, and afterwards you can mute yourself again. So if there is any reason that we cannot hear you or you do not wish to speak, you can always just pop your comment in the comment box, and I will make sure that the rest of the participants can hear you. So this is the agenda for today. After a welcome and a short recap of the previous webinars, Elisabeth will do the introduction, and that will moderate the conversation we will have with each of the patient organizations that are there. And for this edition, we invited Professor Verschuuren, who is the head of the neurology department at the Leiden University Medical Center in the Netherlands. And he will tell some things about what he's doing in the Netherlands to keep the Duchenne and the Becker community safe in these terms of the coronavirus. And last but not least, Nicoletta will also give an update on the Home for Duchenne and Home for Becker campaign that is currently going around the world with many, many beautiful pictures. So first, I'd like to begin with a short recap of the previous webinars that are both to be seen on YouTube. So for the first webinar, we had Professor Morcuri, Professor Montoni, Professor Finder, and Professor Goemans to share their opinions on the questions we gathered from the community in terms of what we know about this COVID virus, how to minimize chances of infection, and what you need to do to, for example, if you need to make changes in your medication regimen. And by the way, spoiler, that is a no. You should not make any changes in your regimen unless your clinician advises you to do so. We actually stand corrected on one point, though, because there are now 2 confirmed cases of COVID-19 in Duchenne muscular dystrophy. This concerns 2 adults now. Is one 29-year-old adult, today's his birthday. He's from Belgium, and one 26-year-old from the United States. Both of them are currently being at home, and they are doing relatively well. One of them was admitted to the hospital, and he spent some time in the intensive care, but luckily they're both relatively okay. And the one from Belgium created a diary where he describes his experiences, and that is currently up on the newsfeed of the World Duchenne Organization. And in the second webinar, we invited Dr. Wong and Professor De Luca to tell us more about the drugs that are being used in terms of steroids and other medication, or which supplement or vitamins that we should take to fight off the infection, if it's even necessary to do so, if it's useful, and which potential treatments there are to fight this COVID virus. And even if they are there, if it's safe for people with Duchenne or Becker. So you can find these recordings together with reports on our website or on YouTube, and the information is currently being translated to different languages. So next to that, we also have our WDO live feed. This is really daily updated with information about everything, really, about updates from the FDA or the EMA in terms of access to drugs, or you can find community letters from companies regarding clinical trials, and all these sorts of things. So it's daily updated. I highly advise you to take a look at it, because you will stay up to date on all things COVID in relation to Duchenne and Becker. So I will now hand the talking stick over to Elizabeth, who will explain something about the current situation and how she will moderate this. Elizabeth, are you there?
Hello, everybody. Welcome to this webinar. And it's like every time we dig a little bit deeper. The first time we really focused on prevention, which is still very important. You know, the best thing we can do still is to prevent Duchenne and Becker boys and girls to getting infected, and their parents as well, by the way. And the medication, the second was more indeed on the medication, and very much also on stress doses, to take paracetamol. And then eat healthy was definitely the answer to all questions about what can I do to boost my immune system. And everybody said, like, eat healthy, enough vegetables, enough fruits, whatever. So where we are now is one step further, and that is, what if a Duchenne boy is diagnosed with coronavirus, COVID-19? What can we do? What can we do as parents? What to expect from clinicians? What are the possibilities in certain hospitals or not, or in countries or not? And this is really something which is not only for Duchenne. I think for more rare diseases, it's very insecure how you will be treated in times of crisis, because in certain countries the occupation of the intensive care units and the availability of beds on intensive care is so limited, or is getting limited, that it might come to the point where they have to do a triage, who will get a bed on the intensive care and not. Apart from that is the place you want to be with Duchenne, it is really important to realize that there are discussions ongoing, and certain countries already set rules about who to accept in intensive care and not. The second point we see is that boys who are not, and girls who are not that, don't need a bed on an intensive care to be intubated necessarily, but are too ill to stay home. But then we see that patients who come with their, or we fear that patients who come to a hospital with their own ventilation machine and their own carers can't have a bed or a room in a hospital, because usually non-invasive ventilation and invasive ventilation, the systems used at home, are open system. So it's not a closed system. So it means an aerosol with the virus comes in the room. And we have looked and asked, like, what could we do? We will discuss about that later. And so there are many more questions, like, what if you have to stay at home? Is your GP informed? What can we do? What do we need to have in place at home? So there were a lot of questions we had, and I'm sure you have them as well. And we really would love to hear. And next slide, please. From all of you. And I think, yeah, you already heard how you can mute and present. So we would really love to hear from all of you, also to be stronger together and help each other and inform each other. Like, what is the situation in your country? Are you aware of COVID-19 patients, but also do you know any guidelines? Are you aware of any policies? Do you know what is the national rules for admission to hospitals? Do you know what your local hospitals are doing? We already have seen that even in the newspaper of the Vatican, there was a report on 10 states in the US who had a certain system in place. In the Netherlands, we have the same, that there are rules who will be admitted to the IC and not. So it's good to be aware of these things, because if you are aware, you can anticipate, we think. But so we are really very interested to hear what you know, what you've been doing. And also, there are, of course, other questions as well. Feel free to answer them, like, is there shortage in your country? You know, can people still get the Vleesakkoord? Are there other issues you don't have access to? So then the first one I think I would like to invite is Pat Furlong from the PPMD.
Sure. Thank you, Elizabeth. I'm Pat Furlong. I'm from PPMD, or Parent Project Muscular Dystrophy in the United States. And I'm really grateful for this webinar series because I think it just sort of, as it has progressed, to dig deeper and deeper into what we should do, what we can do, and what is needed to be done for our young boys and girls with Duchenne. I think this has been really helpful to us in the United States, and I'm guessing to everyone around the world. So the current situation in our country is that we now have apparently more cases diagnosed than China, which is really terrifying for many of our families and all of our families. The primary states that are affected right now are on the coast. The East Coast is New York, and the West Coast, California. So both of those are seeing increasing cases day by day and increasing deaths by as well. So it is generally spreading now across the United States. We have obviously information comes nearly every day as we see the spread of COVID-19 across the country. What is done in each state is the governor of each state is making rules about what could and should be done. In Ohio, which is where I'm from, our governor has an update every single day at noon. And so the state of Ohio is on lockdown, and that means that families are to be quarantined. We are certainly allowed outside to take walks, but or hikes, but we must maintain social distancing, which is a distance of 6 feet. We go to the grocery stores are certainly open, and we have not seen tremendous shortage other than the first few days of panic. But so the grocery stores are quite filled, but most of them have marks on the floor where there is a 6-foot distance between people checking out their groceries, and it's asked to do that and maintain that within the store as well. There are now plastic shields between the person who's doing the checking out and the person who is checking out their groceries. So that's Ohio. There are various limitations very similar to that across many states. Some states like Florida are late to come to that conclusion, and in fact had spring break with many of the patients or many students on the beach, which unfortunately is exacerbating the spread in the United States. As mentioned, as Susie had mentioned in the beginning, we have one person that we know of so far, a 26-year-old who lives in near Baltimore, Maryland, where the cases are not so rampant as they are in New York, but certainly spreading. We do have guidelines, and in the US, we have done webinars similar to this with our experts, neurologists, pulmonologists, cardiologists, and we continue to do these webinars once a week to update our patients on what we're learning and what we know. The Center for Disease Control, the CDC, is our government-related agency that is providing daily updates as well, and legislation has been passed in the United States now to really try to help patients and families who have been affected by the virus. And I'm certain you're seeing it in your own country where people are out of work, restaurants are closed, places of business are closed, and people are really suffering. So there is legislation passed. We have not drawn up specific guidelines for our families because some of these guidelines vary for each state. So what we are advising is check their state governors and then come to us for more general information, which is archived online and available continuously for families. We also have a very good care team, which is Kathy Kinnett, Amanda Wilkinson, and Rachel Schrader, and they're always on call for patients to be calling in, and they in turn have a network of physicians that we can rapidly get in touch with to advise patients about what to do. In terms of local hospital policies, we have certified Duchenne care centers in the United States. There are 27 certified Duchenne care centers in the United States and 2 for adults, or the second one soon to be announced for adults. We are in direct contact with them, but I think there is such uncertainty with the governor of each state making rules, then the various centers and hospitals really having to deal with their own set of rules based on the patients they're seeing and the patients that are being admitted. So they then change rules as they see this spread. And then clearly what else happens in terms of the broad federal government. So it's a very uncertain situation that is changing every minute of the day. So we're working really hard to make sure that our patients are informed not only about the medicines they need and the medicines they may need like a steroid stress dose, where to go, We're also making them aware of clinical studies that they've been participating in and how those studies may be changing depending on the institution they're going to, and really trying to do much more telemedicine with our experts so that we can provide care and guidance to our families across the United States. Thanks, Elizabeth.
Thank you so much, Pat. If you can unmute your, yeah, fantastic. So I think just to have a little system, we continue with countries outside Europe, and I see Nadia is there, correct? Would you be able to say something?
Hi everyone. Yes, I'm Nadia. I'm from Argentina. I'm sorry I'm not able to speak about Argentinian situation because I'm currently staying in Spain. I'm not able to return to Argentina, and also I'm not a doctor, but maybe Javier Linsuain, he's a doctor, he's specialized in DMD, and maybe he can speak to all of you about DMD and this situation in Argentina.
Okay, is he online as well?
Yes, he is.
Oh, please come, please, please.
I can see he joined on the phone, but I cannot hear him, unfortunately. Let's go on to the next person, and if he tries to reconnect via the computer, we might be able to get a hold of him.
I'm still here, so I thought maybe we could go to the next speaker. Meanwhile, Rochelle from Jess's Journey, could you probably inform us?
Good morning, everyone. Can you hear me?
Yeah, sure. Loud and clear. Hi.
Fantastic. Good morning. So I want to reiterate what Pat had actually said. As a patient organization, a very small patient organization here in Canada, we are very, very grateful for all the timely and accurate information provided by the WDO and partner organizations, friends like the PPMD. So I just want to share our sincere thanks for remaining on top of the situation and continuing to provide accurate and timely information. So I don't know if Perry is on the line right now, our executive director, but I'm the marketing and stakeholder engagement manager at Jesse's Journey. So I'm unable to get into too many details, but in Canada here, we're following the guidance from the federal government and the governing federal health regulation body called Health Canada. So both of those streams are able to really give us the main outlook on Canada and what everyone should be doing as a whole. And then similarly to the state or to the US, we have each province that has a little bit of provincial control with regards to states of emergency and what that looks like for each province and city they're in. So we have those two levels of government and really dictating what policies and procedures should be followed by all Canadians. In terms of testing and confirmed cases, I think confirmed cases to date, as of today, we have about 4,743. So by the looks of it, we're around the 16th country of confirmed cases across the world. But what we're doing at Jesse's Journey is trying to stay on top of the timely and accurate information provided by the WDO and partners like the PPMD, sharing that with Canadians. And we actually have our first webinar organized with 6 different specialists across Canada coming up next week. So Canadian respirologists, neurologists, etc., hoping to get Canadianized information out to our families and the community. So that's what we're doing at the moment, and that's our update.
Thank you so much. Did we, meanwhile, are in touch with the clinician from Argentina or not, Suzanne?
No, unfortunately not. So let's try with somebody else.
Okay, then we continue with Europe. Is there anybody else from outside Europe on the line who could comment on their situation? I don't see Israel. Is that correct? Israel's not in this time? No, I don't think so, right? Okay, Then let's continue just with the European countries, where I would love to ask Sally Hofmeister. Can you comment on the situation in Germany?
Can you hear me?
Yes.
Yeah. Okay. So in Germany, I think it's probably similar to most other countries. We have about 50,000 cases at the moment. I have not heard of any Duchenne cases. Yeah. It seems as though for some reason in Germany, we're not having as many deaths. Whether that means we have a good system or not, I'm not quite sure at the moment, but we'll see. Certainly the situation is not as bad yet that all the ICUs are full or anything like that. So that's good news. What I think is also good and was very pleased about, should have been done a long time ago, is that some hospitals in Germany, because they still have beds in the ICU units, are taking some people from Italy and some people from France in various of the federal states over the country. So I think that's good. Help should have been given at a much earlier time, as far as I'm concerned. What else? We also follow, obviously, all the rules and recommendations. We are not on complete lockdown. We are allowed to go for walks as long as it's no more than 2 people or a family or a household. That's a different matter. They can be however many they are. Otherwise, it's maximum 2 people. But we are allowed to go out as much and as often as we want. So that's a huge advantage over some other countries. As for regulations on triage and how that will work, I have seen some recommendations this week that came out, official ones, where it says it should not be a matter of age, religion, race, disability, etc. But they are looking at prognosis, comorbidities, and how they think the person might recover. We're not in that situation yet, so none of these decisions have had to be made so far. But that will probably soon come. What is the case is that people going to hospital, so this is really important for either the younger Duchenne boys or also the older ones, is that they cannot be accompanied, and hospital visits, if they're allowed at all, probably they wouldn't be allowed at all in the ICU unit, and otherwise currently they're reduced to a maximum of 1 hour a day, although I believe that was not in relation to COVID-19 patients. I think that was general hospital. So with all this, what I have done for my son this week, he's 31, he's on 24-hour ventilation. So we've looked through his living will and made sure that what it says in there is his opinion at the moment in the light of what might happen, to make sure that what it says in his living will is what he wants at this time and would want in those circumstances. So we've done that and decided that should he get the virus, we're hoping not, he has decided he would not go into hospital. So with that, that means you have to have other things in place. So we've now spoken to our general practitioner, actually, who is also a palliative doctor, and he was really, really nice, and he will come and help whatever the situation might be. And what he's also done is prescribe a small tank of oxygen that we could possibly use if there were some kind of situation where it wasn't COVID-19, but he didn't want to go into hospital anyway, to support breathing for a while. We don't have it yet. I don't know how easy that's going to be, but that's what we've done. Okay, so that was it.
Thank you, Sally. Thank you. So I got a hint from Nicoletta saying that Ida from Lebanon is also connected. She's connected through the phone. So I hope, Ida, you hear us and you can say something about the situation in Lebanon. Sorry, I didn't see your name before. And the request is to keep it short, because if we go on like this, it will be a very long webinar. Yeah.
Hi, hello, good afternoon. I'm Aida. So if I want to talk about Lebanon, there is no reported case of DMD so far. We are trying to always keep in touch with families and send guidelines that we are able to get. And hopefully that things will get better. We're trying to take benefit from the different experiences that every country is facing. So so far we don't have a lot of reported cases here. Thank you.
Thank you so much. And Nicoletta also mentioned that yes, Sheila from Brazil is online. Sheila.
Yes, I'm here.
Situation in Brazil, yeah.
Yeah, can you hear me?
Yes.
Okay. So related to Brazil, just in general, we have 3,400 cases and 19 deaths, especially in Southeast, but we don't have DMD patients related with case. And we also released a guideline about the COVID-19 about preventions and infection. We are also trying to work with the health ministry, because in Brazil, this is the moment for the flu vaccine. And the government tried to anticipate the flu vaccine, but the group for chronic patients that is include DMD will be just in April, and we formal request to anticipate the flu vaccine for muscular dystrophy community, because we believe it will be important to prevent another kind of disease related to flu. So, and we also release a video, and we try to keep in touch with our community to answer questions, and so help them and try to encourage them to stay at home. We have a kind of political conflict inside Brazil, because our governors try to keep the people in home, but our president thinks different. So, but we really are encouraged all of them to stay at home. Thank you.
Thank you. Then Sri Lanka was online, but she just left, said Nicoletta. So I think then we have most countries outside Europe. Sorry that I didn't see everybody to start with. Then I would love to ask somebody from the Italian group. That's Fabio, and there's also Ilaria. I don't know who is the one on behalf of Duchenne Parent Project Italy who would like to say something.
Yes, I'm Fabio.
Yeah.
From Parent Project Italy. As you know, in Italy, the situation is very bad. we have almost 90,000 COVID-19 positive and more than 9,000 deaths. So the Italian government asked each individual region to identify COVID and non-COVID structures in order to separate the patient's pathways and avoid hospital contamination as much as possible. If this is not possible, the triage path must be separated. From what we know at the moment in Italy, no Duchenne or Becker patients has needed hospitalization due to the COVID-19. Then, in the northern regions, we have a high number of contagions and intensive care is congested. We are very concerned that the situation is repeated in the southern regions with a health system with a lower accommodation capacity than in the north. In any case, due to the high number of patients admitted to intensive care unit, we are concerned that BMD patients, in case of need, will be discriminated in accessing these departments. This is the situation in Italy. For the guidelines, I prefer Ilaria to speak about.
Hello, everybody. And yes, as Fabio said, the situation here is not very good. And we have been trying to work tirelessly to stay in contact with our families and provide them all the information they need. We started, as Elizabeth was saying at the beginning, we were very good at it to start with by giving indications about prevention. And also in Italy, we have a complete lockdown, as you may know, so we're allowed to go out only for grocery shopping and buying medicines, and only people who really need to go to work. But apart from there, we're all locked down in our houses. And still, we're still not seeing what we were hoping to see in by this time. But this maybe helped our community. Also, to them, we encourage to take this indication to an even stronger to follow it very strongly and not to have any contacts with the outside. And fortunately in Italy we only have actually one case that we know of. He is a Duchenne patient. He's a 26-year-old, but he has a mild form. He's an intermediate form actually. So he's 26, but he's not ventilated, and he's quite well, and he was positive to the test, but he doesn't have any symptoms so far. And we will let you know about him, how we will proceed in the following days. But for the moment, he is fine, and we are happy for that. We think we really need now to have some sort of guidelines to understand what we can tell families now, because they are starting to ask, what if? Which is what we are discussing today. And because of course, what if now the main rule here is avoid the hospital, because as Fabio mentioned, we are afraid that if you go to hospital and you have other pathologies, you will not be admitted and be cured as anyone else. So this is very difficult. Okay.
Thank you so much. And then I think from Belgium, there's Connie Pelikan. Keep it short, please, Connie.
Yes, hello. I will try. Hi, everyone. So I'm Connie Pelikan from the Duchenne Parent Project Belgium. In our country, we have two parts, the Flemish part and the French part. In the Flemish part, there is a more dense population, and also more cases accordingly. And we have been in lockdown very fast. We hope we went off the expansional track, but it is too soon to be hopeful or to cheer. We are at the point of 30 deaths per million population now. We have a very good health system in Belgium. We have, at this point, we have 2,500 intensive care units, and that can go up still. About 789 beds are at this point taken in the intensive care. So we still have a lot of capacity, luckily. The lockdown is quite extensive. We are as far as there is no sitting down in parks anymore. You can go for a short walk, but no sitting down. So only the most needed transportation is allowed. We have a 29-year-old male who is doing fine and is at home with DMD and who had COVID. He was sick for about 11 days. What about the prevention guidelines? Most of our families, they know to have no contact with the outside. So they are for a long period now already in quarantine. Most don't even let the kine come to the house anymore. If there are stuff or bags that come in, we don't touch it for a few days if it's possible. We have guidelines from the kines to take over the necessary kine and physiotherapist, so we can take over for the most necessary physiotherapist things. And we are keeping track of the symptoms and the temperature and that kind of things. So we are alerted fast if something would happen to one of our boys. The guidelines the hospitals are giving to us, don't go to the hospital or the doctor waiting room. We have triage points, a few in some triage points where you have to go and wait in quarantine while they do a test to see if you are having the COVID-19. So we also tell everyone, if it happens, take contact with your neuromuscular experts. So as their advice, make sure your own doctor expert knows about it. Then the sixth point about the hospital policies. I don't know about the specifics for the DMD patients, but I do know it was we were told they will look at who has the best chance of a good surviving if it comes to that. And not only the age will be decisive for that, but other illnesses and complications as well. So that does not sound so very good. But it will all be taken in account. Also, the doctors have given out the advice that the weakest patients will not be brought to the intensive care units if we are getting short on the intensive care beds. So that was me trying to be short.
Yeah, you did. Thank you, Connie. Thank you so much. And I think the next for the UK, there's Gary from the Action Duchenne, as well as Alex. But maybe you can do both of you if you promise to keep it short. Gary, can you start?
Hi, up in Scotland, yeah, we're in the UK, we've just passed over 1,000 deaths, unfortunately, and it looks like that will probably double in the next week. We are on a limited lockdown as well, but there's not been any specific guidelines for Duchenne patients. A number of the hospitals are calling up all patients and giving one-to-one advice. We've had a call from our neurologist, and I know that Glasgow is doing the same. And that's it from me, Alex.
Thank you, Alex.
Hi everybody. Yeah, so I won't repeat what Gary's just said. There's no medication shortages that we know of at the minute. There are no known cases, although Francesco Montoni on a webinar this week did tell us about a child with SMA who had been diagnosed with COVID but had sailed through the illness very well. We are working with the hospitals at the moment, particularly the DMD hub sites, to try and work out how we can best help them. This week we actually wrote to NICE to express our concerns about, they've published a COVID-19 rapid clinical care guideline, and we felt this really did discriminate against people living with Duchenne. As a result of our letter and other patient organisations' letter, they've now made a change to the guideline, particularly around looking at the clinical frailty scale that they were using. I can post, I've just copied the link into the chat in case anybody wants to take a look at the letter to see if it would help. Duchenne patients have been identified by the government as highly vulnerable. So there are letters being sent out to everybody, and they recommend that you practice something that they're calling shielding, in which you basically do have to completely try and isolate the person living with Duchenne. Not everyone has received a letter yet, but we're trying to help the families that haven't get a letter, and that does give guidelines of what you should do if you are infected. So yeah, we're also in the UK. We're having Duchenne UK hosting a webinar every Wednesday. It's very specific to what's going in the UK, just to offer some advice and help to our parents.
Thank you, Alex. Was this the end of what you were saying, or you just dropped the line?
That's the end of what I was saying. And a big thank you as well.
Before I jumped. Yeah, sorry. And then there's Carolina, I think, from the Czech Republic, right? Moto, are you there?
Right. Can you hear me?
Yes. We are really interested how you have set this all up in Moto.
Yes. Okay. So I'm Carolina from Parent Project Czech Republic. Our country is doing, I would say, okay. Our government has taken a lot of steps. So we are on lockdown. We had the schools shut down really soon. We do have over 2,500 cases, but about 9 deaths. So not so many, I would say. We don't have any patient with Duchenne having COVID as we would know of. We're trying to keep everyone updated. We're translating all the materials from World Duchenne Organization and from other organizations. We are so thankful for that because, of course, families have many questions which we are trying to answer, and thank you for helping us with that. So we're grateful for this. We have been communicating with the hospitals, but we do think that the most important thing is to make sure that the families know exactly what to say when they get into the hospital. So that's what we're focusing on right now. And we want to release some guidelines this week for that, to remind the families what to tell the doctors and when they get to the hospital. So I would say that's the situation in our country.
Fantastic. Thank you so much. And then Marisol is there from Spain.
Yes. Hello, can you hear me?
Yes, sure.
Hello. Well, in general, the situation in Spain follows the same graphic as Italy, and that's mean that the intensive care beds will be collapsed by next week across the country. We have been at home for 15 days, and the government has extended this for another 15 days. And in Spain, the people with Duchenne and Becker can phone directly to the neurologist, and then they have direct contact with them. And from Duchenne Parent Project Spain, we are in touch with all the reference neurologists of the country. For example, yesterday, one of the reference neurologists said to me that at this moment, all the Duchenne patients have reservations beds, but we don't know what will happen tomorrow. We don't know any infected patient in Spain for the moment. And in Catalonia, for example, they move all the children, independently of the disease, to only one hospital. With this, the rest of the hospital have more free beds, and the intensive care beds are only for the people with more expectancy of life. The oldest people don't have these beds. In Spain, we are translating all the World Duchenne Organization reports, and also we generate different webinars with different specialists in Spanish. We have connected also the South American population with the topics that you have in your webinars, and the people also can ask to the specialists in vivo. Also, we have the Duchenne Parent Project Psychology Department working a lot with families because they are very scared with this situation. And we share videos of physiotherapists with the families to practice at home. We also are fighting for fake news, and we don't have any guidance on what to do if somebody with Duchenne or Becker will be infected.
Thank you so much, Marisol. Thank you so much. And then from France, there is Beatrice, and I think also Françoise. Can one of you speak on behalf of the situation in France? And also, we are interested to hear. We heard the rumor that a girl with SMA in France went to the hospital but was sent home. So, can you please tell a little bit more? Thank you, Beatrice or Françoise, who's there? Hello, Françoise or Beatrice, can you, yeah, okay, Beatrice, unmute, yeah.
Okay. Françoise is supposed to speak the first, so can you unmute her, please?
She should do it herself.
Ah, okay. Okay, so I begin and then Françoise will go on. I'm just speaking very quickly regarding the case you spoke about. So a friend of us with SMA, and in fact, she's around 30 and she's got all the symptoms at home. I mean, she decided to be in quarantine very early compared to the rest of France, so beginning end of February, and very careful, but of course, because she's living alone, she needed helpers, so maybe that's why she got it. We don't know. Anyway, so one night she was with her sister at home, and she was beginning to cough and had fever, so they went to, let's say, general hospital, not a reference center, and after, of course, calling the specific number, the 15 that we have in case of that type of emergency in France, and there the problem was, of course, the disability, because the team was not able to take care of him. I mean, they said, we are there for you and we will do everything. They were very, very kind, but they were not really able to take care of our disease. And so they discussed a lot, but the people were, I mean, professional and nice. And finally, their decision was to stay together. So the lady and her sister. And they were closed in a room together. But after 36 hours, they got the let's say the positive answer regarding corona, and because, I mean, taking care of her was too complicated, they decided, in accordance with the doctors, to come back home and to be confined at home. But she's fine, and it was a, let's say, a smooth form of corona.
Okay, that's good. Thank you. Thank you, Beatrice. Is Françoise able to unmute or not? Otherwise, we will ask Poland. There's somebody from Poland on the line. Could you come in?
Yes, hello.
Hello.
Hello, I'm Karolina Śledzińska. I'm a pediatrician, and I'm together here with Kasia Witkowska, who is a representative of Parent Project Poland. And what is the situation in our country? So far we have 1,400 infected patients diagnosed with COVID and 17 deaths. So I guess we are just at the beginning of the road. We are all advised to stay at home, the schools are closed, but also planned hospital visits are postponed or cancelled, the same clinic visits. So our boys, for example, have problem with attending physiotherapy. So that's why today we've organized the first online physiotherapy lesson for our DMD patients. We also have dedicated hospitals and ICUs who are prepared for COVID patients, but so far in Poland, as I'm aware, no DMD patient has been diagnosed with coronavirus infection. Regarding the question 3 and 4 and 5, so we are trying to follow, like everyone else in Poland, the national guidelines, and also we've translated all of the webinars that you've prepared, so thank you very much again. And we try to stay in touch with our patient through social media, internet, or we simply answer the patient phone calls. And what other problem we have? We might be having a problem with the availability of Calcord because it's not. We usually buy it in some other countries. So right now we need probably to switch our patients to prednisone for this moment. And I think that's it. Thank you.
Thank you so much. Okay, now the last two, and I really appreciate that Jan Verschuuren is still online because he was scheduled a little bit earlier, but we're running a little bit out of time. But we still have Ukraine and Sweden. Shall we start with Ukraine? Who can tell something about the situation in Ukraine? Marita?
Hello, everybody. I am sorry, my English is not good. So I can say in Ukraine we have 300 persons who have the coronavirus. But I know anybody with DMD patients have coronavirus. It's very good. Because usually patients with DMD have unsociable lifestyle. It helps to be in the close in the home. We have translate webinar from World Duchenne organization now in Ukrainian languages, and we share it among doctors and Ukrainian families. So we try. So I am sorry. I'm sorry.
Thank you.
So we wrote to our groups among our families with DMD, and we asked about who, if somebody have questions for webinar for Duchenne organization. We weekend to ask about it, but we didn't have any question now. I think maybe the next webinar we will be have the questions. So
thank you so much. Thank you. And then last but definitely not least is Sweden. That's Ulrika, right, from Sweden?
No, usually family have unsociable style life, and mothers children sitting at home with their sons.
Thank you. But we now invite Ulrika from Sweden. Okay. So if you can mute and Ulrika can say something. Thank you.
I am on mute.
Yes, you are. So Ulrika, tell your story.
Yes. Yes. We have a different approach in Sweden, as you have probably read in the papers. We don't have that many restrictions as in the other countries. From this Monday, we are not allowed to meet 50 people together. Until now, it's 500, so it's a very different approach. The children are going to school, and well, that's the situation, and we have 102 deaths so far. We don't know the numbers of infected because we don't test that many anymore. Every day, the Public Health Agency of Sweden having press conferences and tell us about the latest news concerning the pandemic. And well, that's it. And there is no guidelines in case of DMD patients in our country so far. So we are trying to support each other, and we have a lot of discussions in our group in Facebook and so on, and all these webinars I report to every family. So that's very grateful for us, because that's the only thing we have. I have contact with my son's doctor, but that's like everybody has contact with their own doctor. So, but I think we now see the lack of knowledge of this disease. It will be devastating if we don't get the right recommendations, I think. So it's a problem, and I think we share it with other countries as well.
Yes, thank you so much. Then I said last but not least, but I see Georgios is there. It's quite a challenge to tell Georgios to keep it short, but can you please do, Georgios, please tell just what is happening in DMD in Greece at this moment?
Hi.
Hi.
I will keep it short. I think generally for COVID, I think we're doing okay. There are very strict restrictions. I'm spending now my 19th day out of office, so we're pretty much at home. We don't know of any cases, DMD or BMD cases with the virus. So I really don't have a lot to say. We don't have any special guidelines that we have distributed, but the MDALS, which is the organization that deals with that, does send the general guidelines to the people in need. That's all. I kept it short.
Yeah, you did. I'm impressed. Thank you so much, George. Can we go to the next? First of all, thank you all for telling your story. It's clear that there's a very diverse situation in all the countries, and also that the measures taken are very different, and that the guidance for the families and the interactions are really different as well. So we having all the questions we had before, like for example, what do you do if your child gets infected? What is the best way to look after him? What could be done? We in the Netherlands, we were quite stressed about that. Like, what is the best we can do as patient organizations? And then we were very fortunate that Leiden universities took some actions, and we're very impressed with that and happy with that. So then the next speaker is Professor Jan Verschuuren. And as we always say, when we say this is an expert, nobody is an expert on DMD and corona, as we hardly have seen patients. It's only that we ask people who are experts in the Duchenne field, and then to help them think with us, finding solutions for whatever is happening within the possibilities in their different countries. So next, Suzanne. Okay, there he is, Jan Verschuuren, head of neurology department, but also head of the Duchenne Center in the Netherlands, which is a collaboration between two university hospitals, a center for neuropsychology, and a patient organization. So next, Suzanne. So the first question is,
Elizabeth, just a word. I was interrupted and I couldn't present for France. I'm sorry. It's my computer. It's just went down.
Can we do it later, Françoise?
Yes,
so
yes. I just wanted to. I'm back on, but I'm sorry. That's what I wanted.
Okay, thank you so much. So one of the questions was, how can I be prepared for a COVID-19 infection at home? That is what families asked us and what we wondered. So then I would love Professor Verschuuren to explain how we come to kind of certain activities in the Netherlands.
Yeah, you maybe see my name twice on the list, but I'm now on the phone. Can you hear me?
Yes.
Yeah, okay. So maybe first give you also some background on the situation in the Netherlands, as we have seen a rise in cases the last 2 to 3 weeks, and we're getting more and more strict. Like we also now have this social distancing in the Netherlands, which seems to work well because we maybe see some kind of stabilization the last few days, but have to be very careful about that. We have about 10,000 confirmed cases, about 3,000 patients admitted to the hospital. We have about 600 patients who died from COVID or with COVID. That's about 35 per million inhabitants. And so far we have no confirmed case within the Duchenne community. And hopefully we can keep it like that, because it's clear that what people are doing, that of course that maybe patients with Duchenne are used to be very careful when there is infections around. It's always in the winter season, of course, so maybe they already took care for themselves very much before that the general population did so. So I think that's clearly that they behaved and took precaution differently from the other Dutch. Yeah, well, I prepared also to tell you about what specifically we prepared in our hospital, but maybe you want me first to answer the question and to see how people are prepared at home. Shall we address that first?
Yes, please. I wanted to start from the, let's say, the milder situation to the more serious. Yeah.
Okay. So at home, it's clear already from the fact that we have a case in the Netherlands that prevention, I think, is everything. So there's still no vaccine. There is no cure. There are some medications that maybe can be used to milden the course of the disease, but so far prevention is really everything. So I think that what people are already doing is, in fact, isolating them at home. They take care that they have the smallest group around them. It's clear that many patients need help at home for all the care during 24 hours of a day. So you cannot be completely isolated, but many people keep the team as small as possible and also ask the team members to take the social distancing, the isolation, as serious as possible for themselves, so that the chances of infection are very low. And I think another thing to prepare at home is important, that in case that you need a doctor or you need to go to the hospital, that you be prepared, have the clear information about the diagnosis, about if you're using ventilatory devices, that you have all the information on those, that you have the addresses and names and contact information for the doctors, especially in the field of the Duchenne that you're working with, because if you go being to admit that you you will see, of course, a different doctor, and there will be a lot of stress at the first aid units. So it's good to bring the information yourself.
Thank you. Then I think the next question is then, when you go, indeed, what to do if you can't provide the needed care at home?
Yeah. So I think, well, when you have a very common cold, which you very well familiar with and know almost for sure this cannot be a coronavirus infection, then the advice in the Netherlands is to wait for some time. Of course, you could, I think you will have your own experience with that, and if you feel familiar with that, you could wait and see if it's just goes by itself. In any things that you don't trust that, if you think you get more disease, especially if you get fevers, I think you should contact your general practitioner and inform about that and see what's needed then. Because the options, of course, are then to treat at home with some antibiotics, because maybe, of course, antibiotics do not work against a virus, but can work against a superinfection, because often virus infections can be complicated secondary by bacterial infections. So that's one thing you could do with your general practitioner. And if things are more necessary, if you get shortness of breath, for example, I think then it would be wise that the general practitioner contacts the first aid units and see if you have to be seen at the hospital.
Thank you. And I think we can go to the next question. That what would you consider the optimal setting for a DMD patient with COVID-19?
And now you're referring to the situation at the hospital?
Yeah.
So, optimal setting.
So yeah, optimal setting. I mean, what do you need in terms of care, in terms of equipment, in terms of ability to test? And that comes close to, I think, what led to the solution you set up in the Netherlands is, in fact, this question, like, okay, then we do have a boy with serious or girl serious COVID-19. They can't stay at home. In the hospital, they might not be interested. It might not be possible to accept them because of the care they need. You know, the special care they daily need, in combination with having a non-invasive or invasive ventilation, which is not a closed system. So then how could we? And I think that this is the prelude for the question: what did you organize in your hospital?
So let me point out the situation in the hospital at this moment. I think in the Netherlands would be not very different from abroad. Of course, this COVID crisis, the patients are really admitted to at the end, at the severe cases, to the intensive care units. So there was a lot of focus on the intensive care, because that's, of course, is the critical point. There are too few beds, and that has an effect on the whole hospital. But in fact, aside from the intensive care, only the pulmonology units and internal medicine, they have a lot of patients. And some of the wards in the hospital have now been used as complete units only for COVID positive patients. But aside of that, other units at the hospital are in fact very quiet. So for example, not for example, but especially for example, neurology, we have only a few patients admitted now to the hospital. It's in fact very quiet. So it's a big contrast between the infectious parts, wards, and the other ones. Also, all the surgical units are very low in patients. So what happens is that all the personnel of these departments is either at home, because everybody, because the social distancing, has to stay at home, to work from home, or they're helping out at the wards, at the intensive care units or the other wards. And what we noticed, so that in our hospital, something neurology is always quite special. People are a bit hesitant to take care of neurological patients, so that we are looking for ways to look at our own patients if they are contaminated with, or if they suspicious to be contaminated with the COVID virus. So it's good to realize this two ways of division of the hospitals. On one side, very busy at the infectious side. On the other side, very low in personnel, in fact, not so busy. And so in the optimal setting, and what is happening now is when the intensive care units get complete full, we have 3 regimens in the Netherlands. In phase 1, it's in fact just business like usual. In phase 2, there is a shortness of beds. That's in fact the phase that we are having now. We're getting close to the maximum of patients that's still possible. And we have phase 3, and we do not want to get into phase 3 because phase 3 is the disaster that we have really too few beds for the patients which should go to intensive care. And in that case, in fact, in the Netherlands, the ministry has to claim that this phase has been reached. In that case, it's that only patients, in fact, who have no previous history of disease, who are young, will be the first choice to the intensive care. That, of course, will be an awful situation, and I hope that we not will come to that. It looks like that in the Netherlands we will be able to prevent that and to stay in this busy phase 2. So, but in this phase 2, still there will be very strict who can be admitted to the intensive care and who will be not. And unfortunately, then the patient with Duchenne or with chronic neuromuscular diseases or already dependent on the ventilator assistance, that they have a lower priority than other patients. So that's, I think, a thing which we have to face at that moment. It's just that what people can do themselves is to really think, what do I want? Suppose I get a virus infection, do I want to go to the intensive care unit because it has a lot of consequences? Maybe we can discuss in more detail. And on the other hand, there will be patients who need some more care. And I think that sometimes it almost looks like an intensive care unit at home, but you do not have access so easily to oxygen or to intravenous administration of drugs, or feeding might be a problem. I think those 3, for example, maybe some people can manage that to still do at home, maybe with some extra help, or that could also be help that could be offered outside of the intensive care units at wards which still have not so many patients. So there is, I think, there's some extra measures you could take to help, for example, especially patients with Duchenne in the hospital if the situation at home gets too complicated.
All right, thank you.
I don't hear anybody. Yeah.
Elizabeth?
Yeah, so then I think that maybe more specific, that is indeed what you did now, right? In Leiden, in your hospital, there are some rooms for Duchenne boys with a, how do you call a sluis in English? I don't know.
I will tell you, it's like a portal between the patient room. So the thing which we saw now, so if a patient with Duchenne would come to the hospital, we anticipate that he might bring his own non-invasive ventilatory devices. And the problem of those devices is that you already mentioned that they can spread a large aerosol, and this aerosol contains a lot of virus, is the idea. So you had more risk of spreading virus with those devices than when you have intubated invasive ventilation, or of course if you have no ventilatory support at all. So you really need a room with a portal before that, so that you have at least 2 doors before you get to the hallway, to avoid spreading of the virus over the complete wards. And therefore you have to isolate the patient in rooms like that. And we are so fortunate to have several of those rooms available. And just because I mentioned that the hospital has a strategy that the neurology department is taking care of its own patients if they are suspected to have this COVID virus infection. So we have now, the plan is ready to if patients want to come to the hospital, or they are needed to come to the hospital, that they can use those rooms for screening. And of course, if they are COVID positive, they should stay in such a room for a longer time. And if they're negative, they can go to the general wards. And we're also thinking now of the possibility to in-room then a partner, a helper, someone who can assist with the non-ventilatory devices, because the hospital, the nurses and the doctors in the hospital, they are not that much experienced with those devices. That could form a problem. And you have to think about the room and the use of the materials, because if you cannot stay, of course, the whole day in the same room, maybe also because of the exposure possibly to the virus. Although you can argue that at home it would be the same case if a patient with Duchenne would be infected. But to have the lowest possible exposure, we have to think of how we can also rule in a person who can help the patient, and on the other hand, can use enough of this protective clothing and masks, etc., to be protected from getting affected by the COVID. It's him or herself.
Thank you so much. And I think we were very happy that this possibility now is created. So there is an opportunity for Duchenne families, if their child has to be admitted to the hospital, that there are rooms, which is really great, and we're very grateful for that. Something else which I did not hear today as one of the problems, but in the Netherlands it's a problem that parents sometimes have difficulties getting allowance from their employers to stay home to look after their child. And I think we were asked as patient organization to provide letters about that, but we're very grateful. Maybe you can say something about that as well, that you as group now are doing this. Yeah,
we have in fact wrote a letter, and the letter is now also with our doctors. How do you call this? If patients get sick at your institution, you have a special set of doctors who take care of that, or have to make the rules for that. Bedrijfsarts. So we are the occupational doctors. I don't know the exact English name of this, but we are taking this letter with them because they are the ones who have to send people at home if they are sick at work, so that we not surprise them by our statement, because we think we can make the statement that if a person who is helping out at home, boy with Duchenne, and this person is working in healthcare himself, of course that's very important, but we don't think these are very huge numbers, and it's more important that these patients can isolate themselves, or these persons can isolate themselves and stay at home and take care of the boys with Duchenne. We think that that's more urgent than helping out at this moment at a hospital where they have the chance to be exposed to the virus.
Yeah, or in another profession, right? Because we get all kinds of
you can make this, if you're crucial at home for the care, you can make this argument for any person who's helping out, of course. Yeah.
Thank you so much. I think we go to the next slide, or not, Suzanne? Yeah. So to wrap up, first, thank you so much again for joining this webinar.
I forgot one thing.
Okay. Yeah.
I know we ran out a bit of time, but maybe add one thing. What was very crucial at our hospital to get this done is that we had discussions ourselves with the doctors of the intensive care, of the doctors of the infectious departments, because that already created enormous awareness that these patient groups are possibly coming to our hospital, and that we on front already have made some good rules for that, how to engage them. So this contact was very valuable.
Thank you. And I think it also shows that working together as patient organizations and hospitals can accelerate this kind of activities, right?
Yeah, absolutely. I think contact between all these parties is most important. Yeah, not at the moment that the patient is already there, but just in this stage now. Yeah.
Thank you so much. Thank you so much again. Then before we wrap up, Françoise of the AFM is online, and I hope she's able to unmute this time. Is it gonna work, Françoise?
Yes, it was my internet was went down, so I had to redo everything. So I wanted to tell you that in France, it's just like in England or Italy or Spain, and our boys are locked in the shutdown, and it has been extended for 2 weeks now, so until end of April, I suppose May too. So we have the guidelines up on the website for neuromuscular, and the clinicians, neuromuscular clinicians, are meeting regularly and putting up to date. Our researchers are working in our labs, are working on the diagnosis and new tests. And there is also trial on chloroquine with different groups. We'll have the results of this trial on chloroquine in 2 weeks' time. So we are working also on the new masks, and all the labs are working on this COVID-19. The IFM will be providing masks for the families. And also the problem with our children being at home, we have no more helpers or physiotherapy, just like Alex said in the UK. So we are providing tutorials on the website for the helpers of our families to make their own physiotherapy for the children, the young and the adults too. So that there is also a recommendation to have our urgency kit ready in case we have to go to the hospital. But until now, there is no, we didn't heard of any DMD case in France. That's all. We're just hoping for the new test to test the population.
Yeah.
And the cure. If we can find the treatment.
Yeah, that would be fantastic. Thank you. Speaking about the mask, I think that's one thing we might mention here, that it is not unlikely that the boys who are ventilated now will need some additional oxygen, which is usually not given in Duchenne, but in this case it might be. And most of the masks the boys have at home, there is not an entry portal, let's say, for oxygen, but it's a very simple centerpiece. So it might be useful if people who are ventilated on the mask just look up on the internet and find the centerpiece so you can add oxygen to your existing mask. So then you can still use your own mask when you need some oxygen. Maybe you think it's not needed because the risk is very low, but if you're more concerned that it might happen and your son is on a ventilator with a mask, it might be very useful just to order a centerpiece so oxygen can be added. Because in these times, you never know how long it takes before you order it. Thank you so much.
I was most thinking of the mask for the helpers and the family.
Oh, sorry. Yeah.
From outside, because there is no mask in France and it's a big problem. So IFM will buy some and give them to the families. That's what.
We had a company, an organization sponsoring us in the Netherlands with masks, so that's nice for the families. So then the wrap up is the situation is different. I see in the chat that a lot of people are saying that deflator cord is a problem in their country as well. So that is a kind of more or less general problem, the deflator cord. I think so far we are very blessed that our boys are, and also the girl as SMA did well. It might be even in well, I don't know, months or years. We know that Duchenne were not a higher risk to go through Corona than others, but we are not that far yet. Can I have the next slide, Suzanne? So it's clear what we all can do as patient organizations, inform ourselves about the current policies in our country regarding the triage or not triage, what is feasible for your group if they get infected and can't be treated at home. Discuss with the leading clinicians what to do if a DMD patient gets infected. You could organize maybe a call with clinicians and the different hospitals seeing Duchenne if you haven't done that, just to make sure that you have like a plan. I think it would be nice, that's by the way something is now also in place in the Netherlands, that there's a phone number which is available 24/7 in case of clinicians want to communicate with a DMD expert. So if you or your child really gets ill, that your general practitioner or whoever or ER doctor can communicate with a Duchenne specialist, provide families at home on what to do in case of infection. I think there are a few things you already can make sure, be able to take your temperature, do have paracetamol and so on are the easy ones, and so from there you could kind of build up. Keep giving instructions to family members and carers on hygiene. For example, if you have everybody speaking about masks, but if you have carers coming in from outside, you could also provide just clean t-shirts to them. You know, it not necessarily has to be the hospital equipment, but if you have big clean t-shirts for them so they don't bring in the virus, which if they have been in a place where somebody was infected. And then the next one. What can we do for you? So we hope to go, we are planning to continue with these webinars. We love you to bring in subjects, questions. We're just there to serve, let's say. So don't wait for us to take action. If you have certain subjects you want to discuss, please contact us. We will have this recording translated and online again. You have to tell Suzanne if you don't want your comments to appear online. So what you said today is recorded, but if there's, maybe we make a shorter version of this webinar. But anyway, if you feel like what I said, I don't want to be on YouTube, then just let us know and we get your part out, or when you don't want your name. Next week we will have a new webinar which will be about anxiety and stress for the boys and maybe also for the families in time of COVID-19, which is an important issue. We see that question coming more often because it's not only parents concerned about the boys, but also the boys concerned about their parents getting stressed. So how do we handle this at home? What is a natural way to deal with stress? That will be the subject for next week. And we will continue to support everyone where we can. So with that, I want to thank everybody, all of you, and and then go to Nicoletta, who will do the solidarity. Nicoletta, are you there?
Yes, hello everyone. So as you can see, the campaign is moving forward and it is a success. We are receiving many comments and information from many of you, and we are happy about it. And please continue in this way. And as we always said, we can be stronger only if we stay together and if we respect the rules and if we believe in the community. So let's stay always connected. Let's stay always together, and we will speak again next week.
Back to Suzanne.
Yep, absolutely. I wish to thank everybody for contributing their experiences. If you have any questions considering COVID or anything else, please feel free to contact us, and we hope to provide as much information and care and support as possible.